Eating disorders are severe psychiatric disorders. People who suffer from them have intense worries about shape and weight and engage in extreme dietary practices like starvation and vomiting. Eating disorders tend to start in early teenage years, but a lot of young people have mild versions or even have a few symptoms of the disorders. Treatment for young people when they first become ill can be quite effective, and the earlier you seek help, the better. But sometimes people can have an eating disorder for many years, which can lead to significant health problems, and in extreme cases, even death. And this is why it is essential that we have good treatments. But the problem is, for people with long-standing severe eating disorders, current treatments aren't very effective. And so now researchers and clinicians are asking, what else can we do? As a result, attention is turning to other types of treatment. There is evidence that there is a brain basis for eating disorders. But is there a way that we can treat the brain directly? Actually, there is. And part of my PhD is studying these potential treatments and seeing both whether they have any benefit in eating disorders and how they work. There are several new treatments that are currently being tested, and together these treatments are called neuromodulation. And for my PhD, I'm looking at one specific type of treatment called transcranial magnetic stimulation, or TMS for short. And what happens is the therapist holds a coil next to the patient's skull, and this coil sends out magnetic pulses that affects the electrical activity in the nerves in one specific part of the brain. So it's non-invasive. You don't actually insert anything into the brain. It just feels like a tapping on your head. Evidence is emerging that self-regulation, or the ability to control your own behavior, is altered in eating disorders. Studies suggest that individuals with anorexia are too good at controlling their own behavior. For example, they can resist the urge to eat, which is a really powerful biological drive. Researchers using brain scanning suggest that a region in the front of your brain, called the dorsolateral prefrontal cortex, is important in self-regulation. And all that means it's the top side part of the front of your brain, so about here. TMS to this region has been shown to alter the activity and improve self-regulation in other conditions like depression. So there's good reasons for targeting this area in TMS treatment for eating disorders. These new treatments are safe and have shown promise in treating a number of conditions, including eating disorders. But it's important to note that they're still being tested, they're not widely available, and you need a trained therapist to do the procedure. However, we're hoping that these treatments will improve symptoms and help patients engage in psychological treatments. And if they do, we hope they'll become available for patients who've been ill for a very long time. But importantly, before this can happen, we need to know how TMS works. What is happening in the brain that leads to the changes in symptoms? So for my PhD, I'm not only interested in seeing whether TMS can benefit people with eating disorders, but also understanding how TMS works. And to do this, I'm scanning people's brains before and after they receive TMS treatment to see if TMS is associated with any changes in structure or function of the brain, and to see whether this is linked to symptom improvement. Understanding both whether these treatments have any benefit and how these treatments work will give us a much better idea of how these brain-directed treatments can be used most effectively to treat eating disorders.